Hi, my name is Linda, and in this video, I shall explore the meaning of polyarthritis, the symptoms, causes, the diagnosis, and much more. Polyarthritis has many names such as polyarticular arthritis or inflammatory polyarthritis. The word poly means many, therefore it attacks many joints. At first it attacks 5 or more joints. This disease is called an autoimmune disease and comes under the umbrella of rheumatoid arthritis. It can start with a particular viral infection. Polyarthritis can also cause muscle pain and stiffness. It mainly attacks the shoulders and hips. There are 2 types of polyarthritis, which are either seropositive or seronegative. Seropositive. This means you could have antibodies in your blood which has gone wrong and attacks your body instead of the bacteria or viruses. Seropositive. This means you could have antibodies in your blood which has gone wrong and attacks your body instead of the bacteria or viruses. If you develop polyarthritis, it means that your healthy immune system is attacked by mistake, but there needs to be more research done to understand the autoimmune disease. Studies have found that it is strongly related to the environment we live in, or it could be your genes. It is also related to other diseases, such as lupus, psoriatic arthritis, or children that have JIA. Polyarthritis can develop suddenly or over many months. The symptoms could be a common flu-like illness, inflammation of the joints, or some common ones could include swelling, pain, stiffness, or inflammation of the joints, or you may develop a slight fever, your mobility may become less, you could have difficulty doing daily tasks such as washing up. Other symptoms could be lack of appetite, rash over your skin, feel sweaty, the lymph nodes will become swollen, feeling fatigued, or you may have a lack of energy. Polyarticular arthritis is the second common type of juvenile idiopathic arthritis, and can last through to their teens into their adulthood. Unfortunately, the first 6 months can affect 5 or more of their joints. There are 2 types: polyarticular positive or negative arthritis. The common one is positive arthritis, where it can develop in your young children over a long time. You may see the following in your child: they could have hard bumps under the skin, always feeling tired or fatigued, your child may become anemic. Unexplained weight loss, poor appetite, and generally a feeling of unwell. There is a fact that it is common in girls than boys. It can affect small and large joints, both sides of their tiny body could be affected, they could have an eye disease. In other words, it is like an adult type of rheumatoid arthritis. The second is polyarticular negative. This can begin at any age, but as in the positive, it can develop more in girls than boys, and can start in many joints at the same time. Polyarticular negative mainly occurs in children that have juvenile idiopathic arthritis. It can start at any age, and could be in 1 or 2 joints to start with, then spreads during the first 6 months. The disease could last into their adulthood. To slow the symptom down, their doctor may give them medication like modifying anti-rheumatic drugs, which will control the inflammation. Your child could develop joint damage, and can cause your little one hard to move about and play with their friends, or even problems with their growth. When you or your child develops polyarthritis, your doctor will start by examining you or your child, by finding out the underlying reason why you have painful, inflamed, tender, and swelling joints. A test is done by seeing if your joints are swollen, inflamed, hot to touch, or red at the affected joint, if you can move your joints, if you have a rash, sore throat, and much more. Another examination will be to see if you or your child is anemic, if the painful joints are on both sides of the body, like both hands, both knees, elbows, etc. Depending on the outcome of the examination, your doctor may take you or your child to have an X-ray or MRI scan, or you could have fluid taken from the affected joint for analysis. The treatment for polyarthritis is the same for any autoimmune disease, such as rheumatoid arthritis. It is incurable and you can only treat the symptoms so that they do not get worse. You may be given prescribed medication such as non-steroidal anti-inflammatory drugs, or biologics. This will reduce the joint pains and stiffness. Or disease-modifying anti-rheumatic drugs that can help slow the disease, by using the body's immune system to target the condition. You could do some home remedies which can help you with your pains. For the pain, you could use a warming therapy, such as a warm bath, shower, or a heat pad, which I have in bed as I have osteoarthritis in my lower spine. For the inflammation, it would help if you used a cold pack that will cool down the infected joint. You could use a bag of frozen vegetables. But never put the bag directly onto your skin, always put a towel around the bag. I know you may not want to exercise, but a gentle exercises like swimming, walking, or stretching will help to keep your joints moving for longer. Proper diet will help to keep your weight down if you are obese or overweight, as you are putting more pressure on your already unhealthy weight-bearing joints such as your hips, knees, or ankles. Polyarthritis is an autoimmune disease that can attack adults as well as your child. The symptoms are related to rheumatoid arthritis, where your joints are attacked on both sides of your body. Polyarthritis is a painful, disabling disease that can have a significant effect on your health and lifestyle. However, early treatment and diagnosis can reduce the disability and pain. The symptoms of polyarthritis can be depressing, particularly in the early stages. However, evidence has shown that early treatment can often avoid deformity of the joints. If you think you or your child may be developing polyarthritis, you should not delay and see your doctor for a checkup. I am not a medical professional, and this video is for information only. If you are worried about anything, you should always consult your healthcare professional. I hope this video has helped, and do not forget to subscribe to my channel and click on the bell to receive notifications when new videos are released.